Right, let's give this a go. So when I grab your manual toothbrush, I love these Curaprox Ultra Soft 5/4/60s. They're really, really, really soft. So usually I do toothpaste, I won't today. So what you want to do is brush at a 45-degree angle towards your gum line. So my lovely gums. What I always find is you'll always brush your opposite side better than the side that you usually hold your toothbrush in. So I'll always brush my left side better because I'm right-handed. It's always a little bit more difficult to hold it and brush on the side that you've got the toothbrush on. So let's give it a go. So I just move my lip out of the way so you guys can see. So what you're going to do is hold your toothbrush there and do small little circles. Now I've got really tiny teeth, so these bristles kind of cover the whole surface of my tooth, so you want to be really sure that I'm brushing the tooth and the gum at the same time. So then swap over the angle and carry on onto your right hand side. Okay. These surfaces at the back, they're your biting surfaces. Everyone seems to brush them differently, but a good scrub is fine. Just don't put too much pressure down. So there we go. I always struggle to brush the inside of my mouth, especially if I'm using a manual toothbrush, just because your tongue sits there, it's always in the way, and you can't get your toothbrush in there, and it's usually these teeth right at the back. So if you've got your wisdom teeth, if you haven't got your wisdom teeth, it's usually the teeth that are left there that you struggle with. Hygienists, we clean around them quite often. There's lots of hard plaque that's stuck there, lots of bleeding. Sometimes you get inflammation of the back of the gum, basically. It can be really uncomfortable, painful, bleeding, horrible smell. Just make sure you're brushing them really, really well. People tend to forget these teeth right at the back because they're difficult to get to. If you're struggling to get back there, open your mouth, don't open it as wide as you can, and move your jaw off to one side. Probably a little ridiculous. But again, open your mouth, not fully wide, and move your mouth off to one side. So you should be able to get your toothbrush back there then. If you do have any kind of infection, any kind of inflammation, any kind of bleeding at the back, I'd always suggest brushing with either a toothbrush or a single tufted brush and some kind of antibacterial or antimicrobial mouthwash. Anything with chlorhexidine in is great, so Corsadil, you've probably seen all the adverts about that. Just ensure you're not using it for longer than a week to 2 weeks, because it causes awful staining, which is the bane of our lives, and it stops working after a little while. It's kind of like an antibiotic. You wouldn't take it for longer than you were required to, and you just want to quickly get rid of all that bacteria, and hopefully your gums will calm down. So carry on with the brushing. So let's brush these front teeth. So again, small little circles all the way around, flip over. Inside of your mouth. As I said, I find it really, really difficult. So not these outer surfaces, the ones that you can see, but the inside where they're a little bit more difficult down here. This is where we get lots of calculus build-up, which is hardened plaque, and that's due to ineffective brushing, flossing, using TPs. And people think that just as long as you're brushing the bits you can see, that's the best you can do. But it's really, really important to make sure you clean those areas, because otherwise you get lots and lots of problems. So to try and combat this, try and keep doing the small little circles. If you struggle, just go in with a gentle scrub, okay? When you get to these lower front teeth, you want to hold the toothbrush up at an angle in front of your face. Not the most attractive thing in the world. And again, carry on trying to do small little circles all the way around. Lovely. Again, top teeth, same again, small little circles. When you get to these front teeth, hold it at an angle in front of your mouth. And you can get right into those gum areas. Lovely. Okay, so what you want to do is make sure you wash your toothbrush off, leave it to dry, standing up, ideally. With your manual toothbrushes, the main issue that people seem to come across is they buy a toothbrush where the head is way too big and way too hard. Like I said, this toothbrush that I'm using, really soft bristles. It wouldn't even hurt a baby, they're that soft. You can get so many different types of toothbrushes. When you go into that aisle with the toothbrushes, toothpaste, it's really daunting. There's so many things you can look at, so many different colours, so many different brands. People tend to stick to a brand that they know, whether that be Colgate, Oral-B, something that they see on the TV. Just because it's by that brand does not mean that it's going to be ideal for you. The best thing I can suggest for every kind of person would be to make sure you're either having a medium or a soft bristle on your manual toothbrush. Ideally soft, so you're not doing too much damage to your gums and your teeth. And ideally, the smaller the head, the better. I actually have some of these TPs, they're new toothbrushes, and these are their extra small heads, so these are absolutely minute. But they're great for getting in at the back. So I haven't got my wisdom teeth, I've just got my 7s, which are the molar teeth in front of what would be the wisdom teeth. Unfortunately, mine are off to one side, which makes them really difficult for me to get a normal toothbrush in there. The only thing I can get in there with is my electric toothbrush because the head's tiny, or this one, which is why I have this one on hand at the moment. The thing I'd like you to avoid is getting those toothbrushes with all the bits of plastic. They're massive. You're not going to brush your teeth well, especially if you're like me. We've got tiny little teeth. Anything that's too big, it's just going to fill up. If I get one of those toothbrushes, it covers my 4 front teeth. So it's never going to clean well, and it's never going to clean effectively. So main things to take from this is brushing with a 45-degree angle towards your gum line. Don't forget your gums. The main thing I deal with all day, every day is gum disease. It's completely preventable, just as long as your oral hygiene's good at home. So brushing twice a day, 45-degree angle towards the gums, making sure you're not scrubbing. Like I said, if you're scrubbing towards the back, gently goes. I know it's quite difficult to get back there, especially on the inside of those teeth surfaces. And then making sure that your toothbrush is not too big, not too hard, and that you're not doing too much damage with it. I have some patients who will solely use manual toothbrushes. They don't like electric toothbrushes. That's absolutely fine, just as long as their oral hygiene is good, and theirs is, because their technique is perfect. They know exactly how to brush, they know what they're using, and they know where to go. They know their mouth really well, which is really important. With these manual toothbrushes as well, make sure that you're changing them every 3 months at least. If you've been sick, if you've had a cold, if you've had a cough, especially with this virus going on at the moment, if you've had any kind of sickness, bug, anything like that, make sure you throw away your toothbrush. Obviously sustainability is an issue at the moment, but ensuring that you're getting rid of that toothbrush is going to be the most vital thing, because they contain lots and lots of bacteria. Obviously making sure you keep them washed, dried, don't share your toothbrushes if you can, and look after them, because they will last you 3 months. Ideally 3 months is the cut-off point, because we just want to make sure you're not putting any more bacteria into your mouth, especially if you've been sick recently. If anyone's got any questions, please message me. This is my first video, it's probably rubbish. We'll see how it goes. Bye.